Dr. Evan Schwindt here with MyoLab. Today we're going to be talking all about concussions. Please like, comment, and subscribe. Let's chat about concussions. Now, up to 19.5% of adolescents have reported at least one concussion in their lifetime. In that, males competing in elite sport have been shown to increase this prevalence. It's also important to note of this 19.5% that only about 50% of concussions in sport are reported. Now, this has been seen to be due to the culture of sport, especially in North America, often where we're encouraged not to report our injuries, not to show our weaknesses. So while a lot of these concussions are actually occurring, very few are being reported. Now, with recent media pushes, that definitely has been becoming a lot more prevalent. I've seen the spike of concussions, not because of maybe changes of impact, as in fact our equipment and our management techniques have improved drastically, but rather because it's becoming more socially acceptable to acknowledge when you do take a hit and you may have a concussion. Now also, motor vehicle accidents or car accidents account for over 240,000 concussions per year in the USA alone. It's critical now when you have a concussion, be it from sport, car accident, anything else, that you have it properly managed, as the downhill spiral is very clear in the literature to be coming from repeat events before the trauma has resolved. So ultimately, if you do get a concussion, no need to really be overly concerned about it in the sense of fearing, but rather please ensure you get it checked out by an appropriate healthcare professional and you manage it so it can be resolved before the second, third, or fourth impact may occur, which can cause terrible lifelong events. Now let's get into the cause of concussions. Typically speaking, a concussion is going to happen due to a direct blow to your head, face, neck, or somewhere else in the body, transitioning force up to the head. Now typically this results in a rapid onset of short-lived symptoms and neurological dysfunctions that may either resolve spontaneously or evolve over minutes to hours. It's important to note the symptoms aren't the primary thing that we should be aware of, because they can change so drastically and so quickly, when we're more importantly focused on the neurophysiology and how that affects your body. So most changes or dysfunction are neuropathological rather than structural. Now that is important because that means concussions cannot be diagnosed with imaging. So if you're being told you need to get a scan to check out the extent of the brain injury and the severity of your concussion, that just simply has not been proven in the literature to date. Let's talk about the basic mechanism of a concussion. Simply put, it occurs due to a quick stretching or shearing within layers of the brain, which leads to a metabolic cascade in the form of an exchange of ions, which leads to an ATP or energy dump, causing excitation in the brain. And this then leads to a depression after the energy dump is fully depleted. Take a look at the graph here for further illustration on exactly what I'm talking about and just why you might be feeling the symptoms you're feeling. So as mentioned, the management of your concussion is key. Now it's important to note if you have any red flags such as severely worsening symptoms, headaches so bad you cannot bear it, seizures, repeated loss of consciousness, bruising under your eyes or under the base of your skull, please contact 911 immediately, as we want to ensure you don't have a brain bleed or hemorrhage. Now if not, we advise you to contact a qualified concussion management professional for an assessment immediately. Ideally within 24 hours from the injury is best. Now at MyoLab, this is how we prefer to help you personally manage your concussion. First, it's critical to identify the structures involved through a thorough exam on your neck, vestibular system, visual system, cardiovascular system, and a general spinal function exam. Now, if we don't know what the primary cause of your symptom is through identifying these structures, how can we properly manage them? Gone are the days of just managing a concussion by putting you in a dark room, taking you away from all of your screens, and just letting your symptoms subside. Evidence has been very clear that all that does is prolong your recovery. Especially if it's been more than 2 weeks, we gotta get the body moving. Now, if you are not moving and you are in a dark room away from screens, guess what? As soon as you start to go out into the sunlight or look at your screen, you're probably gonna have some symptoms simply because you're just not used to it. So let's look at how we further identify this. Now, if we uncover that the issue is primarily your neck or cervicogenic in origin, this is what we have to consider. Now, 100% of cases of concussions have whiplash, but not all whiplash situations result in a concussion. The reason is, it takes an average of 90 to 120 grams of force to produce a concussion, while only 4.5 grams to produce cervical whiplash. Now we can affect this through adjustments, soft tissue, acupuncture, cupping, and cervical rehabilitation exercise. Okay, what if it's vestibular, often seen in more dizziness? This is often because of the inner ear, a symptom called, or a sign called BPPV. This is when the ear crystals get dislodged or displaced, and they can result in dizziness. A nice maneuver for this is called the Dix-Hallpike maneuver, where we attempt to reorganize where these crystals are through a very proven method, therefore reducing your dizziness. What if the issue is more visual? Well, we're going to identify this through an eye exam where we look directly at the eye, we're utilizing lights, and we're seeing the function, which is usually where we start to uncover more of the issues. That's going to be through things called VOMs, VOR, accommodation, convergence, and more. And what we're looking for in that exam is if we have an increase or a spike in dizziness, headache, nausea, or fogginess. Now we got to remember, 100% of concussions have whiplash, and the suboccipital muscles at the base of your skull are intimately related to your eyes. So if we're considering the fact that all concussions have whiplash, it's important that we take a look at that neck region and how that connects into the eyes, as there's often going to be some overlap. What if it's more of a cardiovascular thing? Well, we identify this through something called the Buffalo treadmill test right off the bat. So we see how the body moves, what happens for your cerebral blood flow when we start to get you on a treadmill in a nice, safe, professional manner, and we're pushing the blood down to your muscles as you're walking briskly. Does that increase your symptom? After we've gotten to the end of our care plan, depending if you're an athlete, we're going to determine if you would benefit from a Chicago Blackhawks test. This is typically best for athletes. It puts you in a bunch of scenarios that are going to mimic sport, from falling down, getting up, jumping, turning, and ultimately, again, trying to deplete and starve the brain of as much blood as we can in that, just like sport. If you can make it through your Chicago Blackhawks test, chances are you have improved and resolved cardiovascularly and are ready for sport. Now, after all this, there's no doubt about it, the most important part is education. Education on how to prevent another future concussion from happening as best as possible. Now, of course, sometimes we just don't see that hit coming. That's often where a lot of concussions come, is we aren't prepared and aren't guarded. But ultimately understanding how we can best identify when you do have a concussion, how to stay away from concussions, and how to manage them going forward. It's not about being avoiding of the symptoms, but rather understanding which symptoms are okay, which ones are not okay. So we can either ramp things up, keep things plateaued, or down. This is all done in a professional manner to ensure you feel educated and empowered, as opposed to just wondering what the next step is. Now, on top of this, inflammation is a critical aspect that we've already acknowledged in our graph previously. So we strongly recommend simple anti-inflammatory diet, rich in omegas and curcumin for anti-inflammatory effects. Also, utilization of melatonin, as we've discussed. You can have that excitatory period followed by depression. Oftentimes we'll see people with concussions have a hard time sleeping. Sleeping is going to be critical for recovery. Now, also creatine. We mentioned that ATP dump that happens after concussion, which creates that excitation. So we want to supplement with creatine. This can help bring back our energy stores to an acceptable place, so we aren't feeling that energy crash so quickly throughout the day. Now, on top of this, please avoid processed foods, alcohol, and sweeteners. Here at MyoLab, concussions are one of those things that we are very passionate about. We want to ensure, be it sport, motor vehicle accident, or just walking around and getting hit by something in the head that you didn't expect was going to happen doing yard work. We want to ensure that you are able to manage that correctly and safely, and so that way it doesn't take you out of your sport, take you away from your activities with your family, but rather ensure that you are healed up correctly and you don't have long-lasting effects. So we look forward to serving you here at MyoLab.